Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. If you are Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. All right, Gloria, tell me what's going on with your knee. What happened?
Well, I've been having knee pain for almost 3 years now, 4 years. It started when I fell walking and I didn't think about it. But for a couple months later, that's when the pain really started.
You start to have more pain
More.
a few months later. Okay.
So then I went to the doctor, to the orthopedic doctor, and because of the swelling, they said, "Oh, you got fluids in there, so we have to aspirate it."
Aspirate. How many times they did that?
3 or 4 times
Okay.
with the cortisone. And the cortisone.
So you had the cortisone shots with that too?
Yes.
Okay. How many cortisone shots total?
3, 4 times too.
Okay, so 3, 4 time aspiration and cortisone shots. What else?
So they said, well, you have to take anti-inflammatory.
Okay.
And because they aspirate with the needle, I need to have antibiotic. So I got antibiotic with that too. Anti-inflammatory and the cortisone, it didn't do well with my diabetes. So
your blood sugar went skyrocket?
So my blood sugar went high, and of course they have to increase my insulin, and one thing led to another.
Yeah, that's like a train wreck.
Yes.
Sorry about that.
Yes, and finally, after the third, fourth injection, well, I take a vacation because I'm retired early to travel, and I said, well, I have to go. So he said, well, I'll give you another injection and you're on your way to Spain. I said, okay. So I was in Spain for like 3 weeks, and 2 days before that, before the tour is over, I can't walk. And I came back with a wheelchair from the airport. So then I went to his office and he said, oh, well, you definitely need surgery now.
Okay, so what type of surgery?
So he said, we're going to do a partial. And I thought,
so you had a partial knee replacement, and we're going to fast forward like with the type of surgery you had.
So partial knee replacement, I did that for a year, went for physical therapy, and nothing happens. My range of motion is still bad. They give me the adjust brace to bend my knee.
Yeah.
Didn't work. So they said, well, it's still swelling, so we have to draw blood again. I'm like, what?
Aspiration again. Okay.
So I said, what am I supposed to do? He said, well, you're diabetic, your healing process is slow, so it might take another year. So after that, I said, no, I'm going to go seek another opinion. And so I went to this other orthopedic surgeon. He says, oh, that thing is no good, we have to replace it. And
so now you had partial knee replacement, and then you had a total knee replacement.
Exactly.
So 2 surgeries, several aspiration with the cortisone shots. What else happened? What happened after that?
then after the second surgery, my range of motion is still not there. I still cannot bend more than 90 degrees.
Okay.
It's been months, so he decided he has to do a manipulation. I said,
Under anesthesia?
Under anesthesia.
So that's the third surgery.
So then he said, well, okay, go for physical therapy. So I went for physical therapy again, give me more pain medicine, and
your blood sugar went up more?
yes. And then he said, well, there's one more that we can do. We can do a cleanup.
Orthoscopic.
Arthroscopic. Plus, if I'm there, I'm going to do a manual manipulation again.
Another manipulation. So the fourth surgery, the first one, orthoscopic with manipulation. Okay.
Then finally I said, what am I having? Am I having arthrofibrosis here now?
So what did he say after the fourth surgery?
He said, well, we have to wait because, you know, you have went through this.
It's your fault. I'm sorry. Let's always blame it on the patient. It's the patient's fault.
Yeah.
So after the fourth surgery, have you felt any difference, or you've been feeling the
No,
same?
not really, Dr.
Okay.
Jacobs. Well, I should say, I'm disappointed, but I'm a person that would seek more things that I could do instead of sitting in one corner.
Yeah.
Of course,
Don't give up. You know,
I can't
we're
deny
gonna
it.
work on it.
I can't
Yeah.
deny that I had some depression in between. And my
Well,
blood
for
sugar, yeah.
almost 4 years, you
Yeah.
had a lot of
Yes.
surgeries. You're not
Yes.
able to do the stuff you like
Yes.
to do. So let's go over what is difficult for you to do now.
Well, I can't travel. number one. Walking,
Standing,
going
sitting.
up on the stairs,
Okay.
sitting down, getting out of bed in the morning. It's the worst thing,
Mhm.
and that pain is constant.
And you can see the swelling here and the knee compared to the other knee. It's really. So, how much pain do you feel there from 0 to 10? 10 is emergency room.
Hey,
Is that 8 constant or comes and goes?
oh yes, it's constant.
So constant 8 out of 10. What kind of pain? Dull, sharp, aching, and where do you feel it exactly?
It's an aching pain. It's all anterior, lateral, front, you know,
Okay.
and all over here. It's really painful and also tender.
Okay. So she's a nurse. That's why she's anterior. So
Yeah.
it's the front and the outside
Yes.
and the inside
Yes.
of the knee. And how much it goes up when you experience severe pain?
Well,
From 0 to 10.
it could go up to 9 to 10
Okay. And what make it worse?
when I get up in the morning.
Okay.
That's the worst thing because when you
It's
sleep
more
at night,
stiff.
yeah.
And you, of course, you had physical therapy. You had massage. What else you had?
Well, of course, the pain medication.
Okay. So you had everything in the book.
Yes.
Okay. So let's have you actually walk. Okay, we're gonna walk this way.
Which way?
This way.
This way.
Just a few steps. How much pain from 0 to 10? So you've been walking like this for the last almost 4 years?
Yes.
Sorry about that.
9.
Okay, let's come back. You wanna rest a little bit?
Hold on. I tend to do this way here because
Where do you feel the pain?
front, the whole front.
The whole front. So it's been 8 out of 10 for the last almost 4
Yeah.
years, yeah? Okay. So we'll have you lie on your back. I'm gonna measure your range of motion and we'll start the treatment, okay?
Sounds good. Thank you.
Okay, so let's just straight your knee. Okay, so remember these numbers, okay?
Okay.
So, you see this?
What? I couldn't
Minus 20.
see. What?
Jacob, are you keeping
Yeah,
track?
I'll keep track. Minus 20.
So extension minus 20. Normal should be 0. Okay?
Oh my God. It's
Bend
worse.
your knee.
It's even worse now. Ugh.
Okay, sorry about that.
Ooh.
Okay, so flexion we get. Who told you 90? It's 80 degrees.
Well, when I was on physical therapy.
Well, if you push it, that's not really functional. You're the one doing the motion, not me. So flexion is 80, extension minus 20. Okay. Okay, everything should be pain-free, okay? Bend your knees. Relax. Make sure it's pain-free, okay?
Okay.
Are you getting everything here? Like head.
Yes.
Okay.
Actually, let me adjust real quick.
So yeah, make sure it's like the whole thing so you can crop at the end. Does that make sense?
Yeah.
Is that painful?
No.
There you go.
Make sure it's pain-free, okay?
Yeah.
Man, skin is dry here. So you were diabetic before all this happened, but it was under control.
Yes.
Is that correct?
Yes.
And then when they give you a lot of medication, it just make
Made it worse.
your blood sugar really out of control.
My A1C went to 9.8
From what?
from 6.8.
Oh my goodness, they mess you up. Sorry about that.
So my doctor was like, "What is this?"
Yeah. They were not aware that you're diabetic?
Well, they do. I was even telling them, what else can you do? Because, because I'm diabetic. Oh, that's for your doctor to take care of. We're taking care of.
Someone else take care of it? Yeah. How does this feel? What I'm doing?
Well, there's a pressure, but it's not.
Pressure is okay.
Yeah.
Pain is not okay, okay?
It's a pressure, but
She really have inflammation. I can feel the heat from here. I have device to measure it, but that's not important at this point. Measure the skin temperature.
what is the name of the tool that you're using, doctor?
This is the A2.
A2. Oh.
That's what I use to release the fascia restrictions. So I'm trying to release your fascia. Fascia, the first layer, it's like a Spider-Man suit that's wrapping the entire body. Superficial fascia, very thin layer under the skin that's wrapping everything. So when your fascia is tight, it's like you're wearing a t-shirt 2 to 3 size too small. So it does this.
Oh my.
And I invented 2 tools to work on different layers of fascia, because there's a layer wrapping the entire body, and there's a layer wrapping a group of muscle, another layer wrapping individual muscle, and there's a layer wrapping each individual like group of fibers, and each fiber is just very complicated. So, so I have several tools to work on each layer to release that.
Okay.
Because it's really impossible with hand to release it. You have to have something really to grab on those fascia layers.
Okay, well, let me ask you this.
Oh, and what kind of treatment you had? You said you had Graston?
Yes.
Graston.
Oh
How
my
was that?
God, that is a horrible thing.
Was it torture?
Oh, it is torture.
I'm sorry.
By the time I get out there,
They bruise you and
oh yeah,
scar you?
oh, it's more harder to walk.
I'm sorry, I had a patient who had PTSD from that.
What PTSD? Oh my goodness.
Because they're like, it's so painful that they don't want to go to the PT, they don't want to even drive by the clinic because that's, they have bad memories.
When the therapist starting holding that, I'm already like
It's like, are you gonna torture me?
my heart is racing already.
Oh my goodness, I'm sorry.
But
It's not funny.
But I went through with that because I thought
Because patient think, oh yeah, there's no other option.
yeah,
No pain, no gain.
yeah, basically.
But
yeah.
here is the thing. Pain is like a check engine signal light in your car. Okay? When you have that signal light is off. On, I mean. What that mean? There's something wrong.
Yes.
Do you drive and push it and say, okay, let's push the pain so things will get better?
Of course not. That's
So
they do it to
you don't wanna, because if you feel pain, and here's the thing, you cause trauma. What that mean? You're causing damage to the tissue.
and then you're more scarring.
Oh, it's like, okay, you have a cut, your cut is not healing, let's cut it more. Because the new cut can help your old cut to heal faster.
Oh,
That's
boy.
the theory behind it.
Yeah, it's double
It's-
jeopardy.
It's like, how you come up with a theory like this?
Yeah.
You know? It just, hopefully healthcare provider
Ooh.
they start to use some common sense.
Ooh.
Okay, sorry.
Uh-huh.
Make sure it's not painful, okay?
Okay.
Okay. So, let's pull this up.
Okay.
I'm gonna work on your scar tissue now, okay?
Okay.
It's gonna feel cold.
Cool. It's tight over there. Oh. Yeah, I could even feel
The swelling. Your
yeah,
calf
the
is
swelling.
swelling too.
Yeah, yes.
Mhm.
Wow.
Is that painful?
No, I'm just like trying to feel what
You
you're doing.
you feel
yeah.
the knot here?
Oh yeah, yeah.
So I'm actually working on the deep scar tissue and deep fascia here. Is that painful?
Nope. There's pressure, but it's not painful.
Mhm.
Well, it's like I feel it's being released or something.
You feel the release with that? Okay,
Yeah.
that's good.
Yeah.
So where are you coming from?
From
What state?
Chicago.
Chicago. Welcome to California. Hope you
Yeah.
enjoy your visit here.
Oh, of course, the sunny weather, and I
Yeah,
don't
it's,
have to wear this big.
We are in what, February now, and it's
Yeah.
like yesterday was 80 degrees, or 2 days ago.
Really?
Now it's 70. So come and visit us.
Oh yes, of course.
Yeah.
I'm glad that
Enjoy
I'm
the weather here.
able to get out of the 30 degrees weather.
It's
Uh-huh.
it's 30 in Chicago now.
Yes,
Man.
but we're better with the 30. Before it was minus 17 last year.
Okay. Yeah, you gotta just enjoy your stay here.
Yeah.
You feel this band here, this knot?
Oh yeah.
Okay, that's.
I was even showing it to my cousin. I said, feel my knee.
Is that too much or it's okay?
Yeah, it's a little bit too much.
Okay, what about now?
Yeah, that's good.
It's good, okay.
Wow. I could feel the tightness really.
You feel the tightness there?
Yes.
Okay.
Yes.
So I'm just trying to loosen up everything.
Mm-hmm.
I'm not gonna use the Magna Heal now, no seizure or pacemakers or anything, yeah?
What's Magna?
Magna Heal, that's a magnetic, special magnet that I invented
Oh.
to work on inflammation.
Why not now?
You don't have seizures or pacemaker or anything like
Oh,
that?
no, no.
Okay,
No.
so I'm not gonna use a Magna Heal now, just to see if your problem purely from the proliferation stage, which means scar tissue, fascia restriction, and muscle spasm.
Mm.
And if you still have inflammation or limitation,
Mm-hmm.
I'm gonna use a Magna Heal and see how much range of motion can you get from that. So it's gonna feel cold, okay?
Okay.
And I will show you the scar tissue actually with the A3 tool.
Oh,
Okay.
okay. Ooh,
Colds.
that's gold.
Yeah, does that remind you of Chicago?
Oh, yeah, definitely.
You feel those bumpy area here?
Oh my God, yes.
That's a scar tissue. Feel
Oh,
that grinding?
oh my God, that's
Let's
a
pull this
grinding.
up.
Oh, yeah. So,
Is that too much?
no.
Okay.
So, how long are you gonna do this thing?
My average patient discharged 3 to 6 visits.
Oh, okay.
That's probably high 80s, 90%
Uh-huh.
of the patient I see. Sorry.
Okay.
That's when you don't have any like other comorbidity, or because we do some functional medicine, we do nutrition and other stuff that
Uh-huh.
to get to the underlying cause of the problem.
Mm.
So that's why I discharge patient very fast, because we want to make sure you are an
Eating.
anti-inflammatory diet. If you have deficiency in vitamins, mineral,
Mm-hmm.
we want to make sure we meet those deficiencies, because you need D, you need C, you need magnesium, you need
Mm-hmm.
B for your body to heal and to decrease the swelling.
Mm.
So if I work manually here and you have deficiency in several vitamins or minerals,
Uh-huh.
those tools not gonna replace the deficiency. But when we meet those deficiency, your body gonna respond very fast to the tools.
Have you had anybody like me? Ooh, ooh.
I saw the worst case scenario for everything.
Really?
Okay, I will give you some numbers actually. For the last year,
Uh-huh.
85% of the patient for the entire year I saw had previously failed treatments such as physical therapy, chiropractor, surgery, medication, so on and so forth.
Mm-hmm.
Those 85% of the patients I see had failed surgeries,
Mm.
failed previous treatments.
Mm.
So,
Oh, boy.
sorry, is that too much?
Yeah.
Sorry,
When,
sorry.
when you get through the incision site.
Okay, is that too much here?
No.
Think about something you like, okay?
What do you think I should be thinking?
Nothing related to cake or ice cream or candy, okay? Because your blood sugar.
Oh, yeah. Well,
Is that too much? You feel that grinding here?
yeah, I could feel it. Oh my God,
Is that painful or just?
it's
Pressure.
It's a little bit painful. But
Sorry,
I
sorry.
could-
Make
I
sure it's not painful. I'm not trying to torture you
could-
here.
Okay.
Okay. Is that too much?
Oh yeah.
Sorry. You feel this knot here?
Yeah. Oh
Okay.
Jesus Christ.
Okay. So I will have you. Okay, let me take the socks off.
Okay.
Okay. Let's do this. I want you to lie on this side, okay?
Yeah.
I want to be able to do more work on your in the back of your leg. Okay, let's put this between your knees. And you said you have trouble sleeping. How many hours do you sleep now?
It's 4 hours.
The most 4 hours. For how long have you been doing this? For the last 4 years because of your knee?
Yes, because of
Sorry
the
about that. So you're not really getting sleep because of your knee.
knee.
Your ankle's swollen too.
No.
Yeah. You feel that now? Is that too much what I'm doing? It's okay.
It's a
Make sure it's not painful. If you feel pressure, it's okay. Make sure you communicate with me. Do you feel pain or it's not? It's okay.
It's a pressure, but I could.
You feel that grinding here?
Yeah, I could.
Mm.
Oh my goodness, I could feel it like you're trying
It's
to.
like a
clean-
washboard, isn't it?
You're trying to clean it up.
Yeah. And you hear that sound?
Mm-hmm.
Sorry, I got stuff on your clothes. Is that too much now or it's okay?
Yeah, it's too much.
Okay, what about here?
Oh,
Okay, sir. Okay, we'll stop for now.
oh,
That could be a sign of inflammation if you're not tolerating this. By the way, this pressure,
uh-huh.
let me see your hands. This is the pressure I'm using.
Well, that's good in there. It's okay.
But
When
you see how light pressure that was?
Uh-huh.
You're not tolerating that here.
Oh.
That's exact pressure there.
Oh.
That's a sign of a little bit inflammation. Let's give you some water, and I want you to sit up and drink some water and tell me how that feels.
Oh, that.
Can you feel the difference sitting now? Because you were
Oh,
you were
yeah.
very stiff sitting. Look at her, she's moving now. She's kicking.
Yeah.
You see that? Nice.
Yeah.
How's that feel? It was 80 degrees. We're gonna check it. 80 and minus 20. So I'm gonna check your range of motion, just working on the proliferation stage. Then I'm gonna use a magna heel and check your range of motion again and see how much difference when we work on inflammation, okay?
Okay.
So let's lie on your back. The same back.
Oh.
This back, correct.
All right.
Okay, so it was minus
Minus 20.
20.
and
Okay, push
80.
down. Push down. So this is minus 12 now. Okay.
Wow.
Can you feel the difference?
Oh, yeah.
Okay, bend your knee. That was 80 degrees. Okay.
Yeah, it's still, there's still stiffness in there.
You're still stiff there, yeah.
Yeah.
Okay. It's 90 degrees. I don't know if you can see it.
Wow.
I can see it here, right in here, 90 degrees. 90 degrees. Okay, so we gain 10 degrees. That's not.
Wow.
We need to get more, okay?
Okay.
Okay, so you had 2 manipulation under anesthesia, okay?
Okay.
Okay, I'm not gonna do anesthesia. Okay,
I hope not.
okay, but I'm gonna use a magna heel. And we'll see how much we can gain. You wanna see how strong this magnet?
Oh my god.
Pull it.
Oh. Oh.
So when we measure the length of the magnetic field when I use it,
Mm-hmm.
it's around like at least 5 inches in between,
Oh.
4 to 5 inches. So I'm actually going deep 5 inches to get the swelling down.
Okay.
So we'll see after using the magna heel
Mm-hmm.
how much you will gain. So if you have a lot of inflammation, usually recommend for patient like have severe inflammation, you buy the Magna Heel, you just wear it.
Where?
Yeah, with the ace bandage.
Oh, okay.
You know, so it depends on how much inflammation that determine how long you're gonna use a Magna Heel. So if it's mild inflammation, usually take a few minutes, just use the magnet like this. Moderate to severe, it's several hours. So I usually tell patients just as needed. The more inflammation, just wear it all day long or at night when you sleep. You know. So you definitely, we can visually see the swelling, like
Yeah.
that's a sign of inflammation.
Yep.
You know. How does it feel?
Well, it feels good though.
It feels good?
Yeah.
Yeah.
It's
You feel the swelling going down, like you feel the pressure releasing with the
Yes.
Magna Heel?
Yes.
That's very good. Yeah, this is very common feedback from patient. You can feel the fluid start to decreasing.
Yep.
That's good. And I coat it with anti-inflammatory coating, the Magna Heel.
Oh.
So I'll try to get the maximum effect for decreasing inflammation. How does it feel?
Oh my God, it's pretty good. I mean, before, if I feel that with my hands, it's so sore, you know?
Yeah, touch it with your hand.
Yeah,
It's
when
sore
I
to
touch
touch.
it, yeah.
That's because that's a sign of severe inflammation. The soreness, you're going to be very sensitive to touch.
Yep.
Okay. So, you remember the numbers? We get to 90 degrees, okay?
90,
90 and
10.
minus 12.
minus 12 and 90.
Okay. So let's see. Push down. Okay. Now it's minus 10, okay?
Wow.
Let's bend your knee. See how much you can go as far as you can. Okay, that's 95.
Wow.
Okay, we need to get it more. 95.
Yeah, I
Where
could
do you
still-
feel the tightness?
Right in front.
Do me a favor, let's do 10 back and forth.
Like this.
Yeah. So you gain 5 degrees with the Magna Heel. You gain 10 degrees with just working on it manually. So, okay. Let's lie it down again and we'll measure it again.
Okay.
Okay? What I care about more
Yes.
is the flexion.
Okay.
10, I don't like, it's good. It's
Yeah.
better than 20, but we want to get you more flexion because that's what you have hard time.
Yes.
Because you need 90 degrees to sit on a chair. You want
Exactly.
80 degrees, bend your knee.
Wow.
How is that?
Whew.
It's 102.
Wow.
Okay,
Oh my goodness.
102 from 80 degrees. Do me a favor, just do 5 more bending. 102.
Two.
Are you weak or what's going on?
Well,
Just feel a little bit stiffness?
oh yeah, it's really the stiffness, and I
Okay.
could still feel the stiffness.
Okay, I
in it.
want you to do the motion while I'm putting the Magna Heel on it and tell me if that make a difference. Is it different?
Yeah, it's a little bit.
Is it looser?
Yes.
Mm-hmm.
And of course the pain is traveling to the
The
hip.
tightness
Yeah,
here?
yeah.
Okay.
The tightness is.
What about when I do this? How does that feel?
I don't have the pain there.
So that's pain.
The tightness is over there, but there's no pain there anymore.
When I put the magnet here, the pain gone here, yeah?
Yep.
Where is the feel the tightness exactly?
It's still in the
In here?
anterior. Yeah.
Am I on the right spot here?
Yes.
Okay, do the exercise. So you see, so with the magnet it's easier now.
Mm-hmm.
See, she's moving faster now. Look at this. And your tightness is okay now, it's much better.
It's a lot better.
So that's a sign you probably want to use the magnet for a longer time
Oh.
because you have inflammation. At least you're able to do the exercises,
Uh-huh.
but you have really severe inflammation. Because I have total knee patients, sometimes we get 20, 30 degrees in just a few minutes working on them if they don't have inflammation. But when you have severe inflammation, that is, we need to be aggressive of decreasing that inflammation because that's what make you feel tight. So let's bend now. See how fast she's moving now? Okay. Alright, so now we are, yeah, 102, close to. Okay, so let's actually stand up and we'll have you walk back and forth. Let's drink some water. That's not bad, from 80 degrees. So 22 degrees. So the constant pain, because you were saying it was 8 out of 10, how is it now?
I would say 6.
So went down to 6,
Yeah.
where do you feel it?
It's still in the front.
In the front, okay. So we'll have you walk without the Magna heel
Okay.
and tell me how you feel now compared to before. And then after that we'll put the Magna heel on your knee and have you walk and see how you're doing with the Magna heel, okay? She's not actually having holding on the cane. Are you trying to show off now?
Oh, yeah. I would like to run now.
Okay, we'll do that after the video. How's that? You see how fast she's moving now?
That's
How does that
amazing.
feel?
Oh my God, it's a big relief
It's a
right
big
now. It is.
Let
It
me
is.
see the brace you have, and I'm gonna attach the Magna heel to it. Okay? And I want you to tell me with the magnet if that make a difference, okay? Okay. Where is most of your inflammation? The tightness? In here?
Yeah.
Okay, let me do it this way. Sorry, it's gonna be a little bit tight, but this is... Okay, let's walk. And tell me any difference with the magnet or using the magnet or without the magnet? How does that feel?
Right. It has a little bit of a difference when I'm with that, with the magnet.
What's the difference? Let's go back and forth.
The
walk
ease of bending my knees is a lot
You
better.
see it? She was using the cane before. Yeah. How's that?
Very good.
You could not even do quarter of this distance.
No, I mean I get so tired quickly,
What
and the
about now?
pain and the pain is really limiting me, and the movement and the stiffness is really giving me that.
We're gonna walk back and forth. Make sure it's pain for you, okay? How does that feel? Do you feel any pain now or it's no? No pain.
No,
No pain? Okay.
no, the
With the magnet, no pain?
no.
Okay.
The tightness is still there, but I could, you know.
Well, it's gonna take a while to the tightness because you have really severe swelling. That's gonna take a little bit time with the supplements and the Magna heel because it's very swelled up. What I care about is your pain because if you don't have pain, you're moving around, you're functioning.
Oh yeah, I mean,
That's
look
what I
at
care
it when
about.
I'm in their house.
Yeah.
I was like, now, oh my God.
Now you. Yeah.
How come I didn't see you right away?
Well, now you know.
I mean, you're the answer to my trouble right now.
Well, I'm glad you were able to come from Chicago here.
I mean, I never stop looking for some solution.
Don't give up.
And,
There's a solution always.
And before I even went to an orthopedic, they were delayed for 2 weeks, and most probably he said, I'm going to do surgery on you. Most probably I did one for surgery already.
Oh.
But then I found you.
Okay, don't tell him that you found me, okay? He will not be happy that not doing another surgery.
And then I'm like, I just gotta get in touch with you.
See how many times
all
she
I
went
was-
back and forth?
My brain is just like saying, I'm just
With
gonna
no
get
cane.
I'm just gonna get in touch with you, and I don't know what other people has to say, but it's my body and I have to try something different, and it's unconventional. I know how physical therapy would say, Gloria, we need to do this thing to you, and I'm like, okay. I keep saying okay, but I'm not getting better.
What that mean? Do you remember the definition of insanity? Doing the same thing over and over, expecting different outcome.
Yep.
Yep.
Well, it's like you're doing research and you do the same way, so nothing happens.
Are you trying to show up now?
Well,
Sort of.
You walked 2 miles so far, okay?
no,
That's good. Any discomfort?
No, I'm a walker.
Yeah.
I'm a walker. I
So
like to walk.
what do you think about ASTR treatment? So to tell patient had total knee or any injury, you are a nurse,
Yes.
and you had 4 surgeries failed. You had injections, 3 injections, and cortisone injection. You had a lot of pain medication. So what do you think about ASTR treatment? What we used for like just a few minutes.
ASTR treatment is something that you guys has to come here. Never delayed anything, because for me, I can't believe it. Just when somebody will tell me that it would be like this, I won't believe it. But I'm here now. So if I'm here now and I'm feeling it,
Yeah.
this is the
I'm glad
guy.
you feel better.
This is the guy.
Yeah, good. Awesome. Thank you.
Oh, thank you, Dr. Jacobs.
Yeah, we're glad you're feeling better.
I'm a little emotional.
That's good. Well, you're doing great now. You ready to run a marathon?
Oh, yeah.
Yeah.
Come on, let's go shopping.
Yeah, well,
I got my knee back.
that sounds good, except the money part of shopping. That's good. I'm glad
Yeah.
you're feeling better. Yeah.
Look at that.
Well, it's standing on 1 foot. You see that?
Look at that.
You're really trying to show off here. That's good.
Oh,
Yeah.
my.
That's look good. You're really doing
Boy.
great.
3 to 4 years of suffering, and I got this for just a few
Minutes.
minutes. How did that happen?
Well, there's really a lot of studies support this, and there's science behind it. So it's working on the root cause of the problem. So I'm using the MagnaHeal to decrease inflammation. There's a lot of scar tissue, a lot of fascia restrictions. If we don't release it, you're basically not treating patient with after surgery, and you visually can see the swelling. You visually can see and will feel the scar tissue. Stretches is not going to break the scar tissue. It's not going to decrease the inflammation.
Yeah, because that's what I was told. that
Actually,
to bend your
stretches
knees.
will cause more inflammation based on the studies. So it's really, some treatment actually make things worse. When they start to study those grandfather treatment that been used for years, they were realizing it's not actually getting people better. Actually, some of them make them worse. But I'm glad you're feeling better. Yeah, awesome.
Oh, Dr. Jacobs.
Yeah, that's good.
You changed my life just for a few minutes.
Yeah, thank you. Thank you. It's awesome. We're glad you're here.
See, you just have to.
Be persistent.
Yeah.
Don't give up.
Yeah.
That's all.
Yeah, that's what I
Yeah,
did. That's
yeah.
what I did.
That's what I did after my cancer treatment, because I had 6 doctors misdiagnose me and give me an effective treatment. I almost lost my life 3 times. If I gave up, I'm not here today.
There you go.
You know? So don't give up.
Now you treated me,
Yeah.
and I
yeah.
thank you for that.
Yeah, thank you.
Yeah.
Thank you. Awesome.
Ah.
Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen.